Hello everybody, welcome to our channel Nursing Virus. In this video, I am focused on the nursing research. This is one of the vast subjects in nursing. I hope this video class will help you to gain knowledge regarding this subject research. And also check the previous videos for other nursing subject MCQs. Let's move on to the discussion. Consider this is not the class. We are going to play a game. Through this, you can see your level of knowledge on the research subject. Here, I made some game rules. In this class, total 25 MCQs. You will have 10 seconds to answer each question after reading the questions alone. If you want the additional time, you can pause the video and you can think more to provide the answers. You can calculate your score by yourself. If you have doubts on any question, write it in the comments box.
Question number 1. A systemic inquiry that uses disciplined methods to answer questions or solve problems is called.
The answer is research. This is one of the definition which is given by the Pollitt and Peck in the year of 2006.
Question number 2. What is the most reliable means of obtaining nursing knowledge?
The correct answer is scientific research. So the rationale for this answer is the scientific research is the systematic investigation of scientific theories and the hypothesis. So here the meaning for the hypothesis, the researcher prediction of the outcome of the research study based on the research variables.
Number 3. The main characteristics of scientific research is. So the correct answer is experimental research. The experimental research design are concerned with the examination of the effects of independent variable on the dependent variable. So where the independent variable is manipulated through the treatment or the interventions. And the effect of these interventions is observed on the dependent variable. For example, independent variable is nothing. What the kind of intervention we are providing to the person or the samples. Or the dependent variable is nothing, what the outcome we are getting from the towards on the person through the form of independent variable. Here are the examples. We are going with the experimentation for the two groups, the group A and group B. Each group will have the equal number of samples. For the group A, we are providing the violent video games, and for the group B, non-violent video games we are providing. So those two things will be considered as independent variable. So whereas on the both group we are going to observe the child behavior towards the peer group, that is considered as dependent variable that will use to get differ on the individual person. Question number 4. Which one of the following is the scope of nursing research?
Correct answer is to develop the knowledge. So here, to develop the knowledge regarding the various aspects of the nursing, that is the nursing service, nursing education, nursing administration, and nursing informatics.
Question number 5. The primary task of nursing research is.
So the correct answer is to contribute to the scientific base of the nursing practice, as we discussed in the previous question. That is the correct one.
Question number 6. The research that is done to learn about cultural behavior and cultural artifacts is called.
The correct one is ethnographic research. So that is known as the studying of cultural behavior and cultural artifacts of the particular group.
Question number 7.
which is not a true experimental research design.
So the correct one is exploratory design. So here the list of the true experimental designs are: first one, pre-test, post-test with control group, post-test with only control group, and third one, Solomon 4 group, and fourth one, factorial design, and fifth one, randomized block design.
Question number 8. The group that receives the experimental treatment condition is the
So here the correct answer is experimental group. That is nothing who are receiving that intervention that is considered as experimental group, and that if they are asking about the control group mean who are not receiving the treatment.
question number 9. Which of the following statement is not applicable to use a evidence base in nursing practice?
Here the correct answer is the use of research evidence in the nursing practice does not need to be evaluated after its use or implementation. Actually, whatever the intervention we are providing to that patient or the samples, compulsory we need to implement. Then only we will know the effect of the independent variable or the interventions.
Question number 10. Study of a person who has already contracted the disease is called
Here the correct answer is case control. So the case controls studies are often called as retrospective study. That is nothing that track backward from that outcome to exposure. That means nothing. Whatever the person where already occurred the particular disorder, we are going to study the root cause of the particular disorder. That is called as case control study.
question number 11. Quantitative research is a process to
The correct one is A. Evaluate theories and hypotheses. Always the quantitative form of study, we need to examine the theories and as well the researcher hypothesis.
question number 12. All the following are qualitative research methods except
So the correct one is correlational study. So here the types of qualitative research designs are: 1. Historical research, 2. Phenomenological method, third one ethnography, fourth one grounded theory, fifth one secondary analysis, and sixth one meta-analysis, and seventh one epidemiological research, or it's otherwise known as descriptive form of research.
question number 13. Which of the following is not a step of quantitative research process?
So the correct answer is meta-analysis of the research study. Actually speaking, the meta-analysis is a statistical analysis that combines the results of multiple scientific studies. It can be performed when there are multiple scientific studies addressing the same question, with each individual study reporting the measurements that are expected to have some degree of error. Actually, this meta-analysis can be performed in the qualitative form of research studies.
question number 14. Which is the research method that combines both a longitudinal design and a cross-sectional design?
Here the correct answer is convergence design. A convergent parallel design entitles that the research concurrently conduct the
quantitative form and as well the qualitative form in the same process of research. The analysis of these kind of studies can be done independently and the interpretation of the result can be done together.
Question number 15. Which research paradigm is least concerned about generalizing its findings?
So here the correct answer is qualitative research. So here the least concerned about the generalization is called as qualitative form of studies and most concerned about the generalization process under the quantitative form.
Question number 16. A type of research that is undertaken within a defined period of time on a group of people who share common characteristics is called as
Here the correct answer, cohort study. The cohort study is the particular form of longitudinal study that the samples a cohort which they are having the common characteristic like a birth order or the graduation. So those things considered as cohort form of study.
Question number 17. Which of the following falls under experimental study?
So here the correct answer is clinical trial. On the picture you can see the types of epidemiological studies under that experimentation and as well the non-experimentation. This is one of that randomized study, that is that clinical trial, or that is otherwise known as controlled trial.
Question number 18. Phenomenology has its own disciplinary origin in
The correct answer is that phenomenology always having its own philosophy. That phenomenology study is nothing, that is the studying of life experience within the particular group of people.
Question number 19. In cross-sectional research designs, the data
on the cross-sectional research design, the data can be collected at the particular point. So the cross-sectional research design is a type of observational study design. So here, the researcher measures the outcome and the exposure in the study of the participant at the same time.
Question number 20. Which mode of clinical application for qualitative research is considered to be the sharing of qualitative findings with the patient?
The correct answer is anticipatory guidance. So when some form of qualitative research when we are doing in the clinical practice, some information need to be shared with the patient when we are assessing kind of a risk factor or causative factors for the particular disorder. So at the time we can share those information with the patient to reduce the risk of the particular illness.
Question number 21. Name the study in which the observations or data are referred to for more than one point of time.
So here the correct answer is longitudinal study design. So the longitudinal study design is otherwise known as longitudinal survey or panel study. It is a form of research design that involves repeated observation of the same variables. That means on the same geographical person or the samples will use to check or gather the information over the period of time again and again.
Question number 22. How does audit differ from research?
So here the correct answer is, it does not need as many people to collect the information. Here, the audit means it is an evaluation or the examination of something by a person or the group of people. Whereas on the research, it is a systematic inquiry that uses disciplinary method to answer the question or to solve the problems is called as research.
Question number 23. Prevalence of disease in a community can be found out by
The correct answer is cross-sectional study. The cross-sectional studies are the relatively quick way of getting an estimated of disease, incidence or prevalence in the community area.
question number 24. Crossover design is also known as
The correct one is repeated measures. So the crossover design is the repeated measurement design, such as that each experimental units or the client receive the different treatment during the different period of time.
question number 25. The basic research is also known as
The basic research is always called as the fundamental research for the nursing field. So thanks for joining that discussion. I hope this video become more helpful when you're going for that various exam preparations. Check the playlist or the video description for the further subject MCQs. Thank you once again.
Thank you for watching this video. If the video is informative, subscribe my channel and like and share the video. You can write your comments too.